Anastasia.
This time on Dr. K's Exotic Animal ER.
I'm so excited to see your gang.
Lucifer, an Argentine black and white tegu, gets checked out.
Prehistoric. Wow.
A lethargic raccoon with breathing problems.
That is not normal. Oh my gosh.
And Dr. K sees an Amazon with a scary history.
Watch out. He has apparently died twice. I don't think third time would be a charm. Snap quick. Just go. Hurry, hurry, hurry. The machine reset. All right, I'm bailing.
Dr. T starts off the day with a family of highly unusual reptiles.
And because we don't see these reptiles very often, Dr. G's going to come in because we're just going to have too much fun. We have to share it. How's it going, guys?
Good, how are you?
Good. I'm so excited to see your gang.
We have Apollo, who's an albino ball python, Lucifer, black and white tegu, and Anastasia, who's a 5.5-foot black throat monitor.
All right. So everyone's doing well for the most part. But I heard someone has a respiratory infection.
That's Apollo, the ball python.
So because he's infectious, we'll save him for last.
Okay.
This must be Lucifer. I heard he's cranky in his cage, but once he's out, he's fine.
Most of the time.
Okay, buddy. What a good boy.
Lucifer, we got him from somebody who wasn't taking care of him. He was really thin. He was outside. We got him. We brought him back to health. And his name is Lucifer because he's crazy.
Oh, he looks so...
That was one of the rescues we did.
You guys take such good care of your animals.
When you walk by the cage, he'll open his mouth wide and come at you. And when he's out, he can be real calm or he can be crazy. Depends on his mood.
He is in great body condition. So here in Florida, tegus are actually an invasive species, which is a big problem because they're actually eating the native wildlife. He is in great body condition. What do you feed him?
He eats frozen thawed rodents. He eats hard-boiled eggs.
Every other day, every day?
Every day he gets something, a little treat.
You don't treat every day, you spoiled little boy. I need to look in his mouth somehow. Can I open that? Do you see his epiglottis? He's about to, he'll breathe in a minute and his trachea will open right there. That's so cool. Looks really nice and big. The choana slits look beautiful. His teeth are pearly white. Wow, do you brush every day? He looks so good. Okay, you did excellent. Let's get this big girl out.
Anastasia is a black throat monitor. She's 5.5 feet long and tame as a puppy dog. She'll sleep on the couch with me for hours.
Oh my goodness. Prehistoric. Wow. I love to put my fingers on it. I just think it's so cool. I actually have never seen a black-throated monitor, so I'm really excited. She's much more relaxed. She's really let me get a really good palpation. Black-throated monitors have the ability to really do some damage. In captivity, they're known to be very docile with a mild temperament. Can you open her mouth too, just like his?
Can you hand me that egg behind you?
Oh, yeah. So it was really awesome that the owner brought eggs, so that way I can do a really good oral exam when it opens up its mouth to grab the prize.
Want this?
Teeth look great, clear looks great. And that was it.
That was
Oh my gosh, you didn't even chew it. That was it. That was perfect. That's all I needed to see.
She'll eat 6 eggs at a time with the shell usually.
Girl, you're beautiful. Okay, now let's look at Apollo. Hi, honey. All right.
She's only maybe 2 years. We've had her a year.
Wait, is it a boy or girl?
Boy.
Okay.
I always call everything her. I don't know why.
I do too. That's a bad habit. When's the last time he's eaten?
Last week.
Okay, good.
She's due to eat this weekend.
What a good boy you are. Such a good boy. Not gassy. Feels really, really nice. But those lungs are pretty rattly.
Every once in a while, she'll open her mouth and take a gasp, because I don't think she can breathe out her nose at all.
I can hear her. Oh, I can feel
Feel it and you can hear it.
G, hold that. You can feel what we're talking about.
Oh my goodness. That's
Very
that feels
rattly.
awful. And there's foam on the side of the mouth.
What is the humidity in his tank? Do you know?
That I don't know.
Okay. Balls have to have at least 60% humidity. And it sounds kind of counterintuitive, but the low humidity oftentimes is what causes my respiratory infections in these guys.
I'm really concerned about her respiratory issue with pythons. They can get really bad, and in one day they can go from being okay to dying.
Now, what I recommend in snakes is doing what's called a transtracheal wash. So I pass a little tube, sterile tube down his trachea, put a tiny bit of saline in it, and then that allows me to wash the lungs, and so then I'll hopefully be able to catch that bacteria in the lungs. And then I'll culture that material, and then we'll know what's growing, and also we'll know if my antibiotics are working or not. If these snakes aren't kept at least 60% humidity, they can have respiratory issues quite frequently. So we talked to them about, correcting the humidity and doing some diagnostics to figure out what exactly is going on. We'll talk to you soon, okay? Yep. All right, buddy. In the warm room you go.
Apollo warms up while Dr. K sees Lewis, a feisty 35-year-old parrot. Charlie and his neutered self will recoup. Meanwhile, Dr. T treats Apollo the ball python for a respiratory infection.
Hey, beautiful. We're going to do a tracheal wash on Apollo. And the reason why we're doing a tracheal wash is we want to be able to culture what bacteria is in his actual lungs. I do suspect he has pneumonia. I can see the trachea, so I'm just going to wait for the snake to breathe again. Oh, there you go. Oh my God. And then I push it down. Pretty far, actually.
Do you pre-measure how far you're gonna go?
No, you can picture a snake's lung like a big sack. So up towards its head, it has all the alveoli, where the oxygen exchanges of the lung. And then towards the end of the snake, it actually turns into an air sac. So it's a very thin membrane that exchanges air, but it doesn't have the same properties of the first part of the lung. This is possible because they want to be able to exchange oxygen a little bit differently, kind of like a bird. Okay, and then put the snake up. And I push that in.
The transtracheal wash done on snakes is kind of a tricky procedure, and we don't often do it, and there's inherent risk you could injure the animal doing it.
And then they're going to couplage the snake. And what this is doing is just kind of breaking up everything, hopefully knocking some of that bacteria or whatever is causing the pneumonia. It's coming out. Oh, it's really frothy and really thick. Wow. I can see flocks of pus in there, so at least we know we're going to get a really good culture, really good cytology. Oh, wow, that's gross.
Yeah, it's really gross.
Ew. You okay? Can you breathe? You breathe? Ooh, oh. I looked at Tom and I was thinking, oh my goodness, did Apollo just stop breathing? Can you breathe?
Sunday night.
Can you breathe? Ooh, oh.
After the tracheal wash, Apollo's breathing raises alarms.
Can you breathe? It's okay. Can you breathe? Just for a minute, Apollo looked like he stopped breathing. Thank goodness, though, it's a reptile and they do not have to breathe very often. Dr. K always says breathing's overrated in reptiles.
Yeah, I think it's all right.
I'm sorry. That's so stressful. I'm so sorry. What the tracheal wash did was enabled me to gather a really good diagnostic sample of what is actually in the lungs. And boy, did we get a good diagnostic sample. I mean, that fluid I pulled out was thick and mucousy, and you could see little chunks of white flakes, pus in it. In any reptile, this is really important that we take this time to really get an accurate diagnosis, because I could be giving this snake antibiotics for 3 weeks without any improvement at all, and I won't know if it's the antibiotic that's not working or if it's I have the wrong diagnosis. So I'm scanning around trying to find a really highly cellular area, but I am seeing the slide riddled with bacteria. I don't see any fungus, which is great, so that's good. Okay, so what we're gonna do with Apollo is we're gonna go ahead and focus on her humidity. Make sure that we're increasing the humidity to at least 60%. I'll get the culture back by Monday, but we're gonna send them home with some antibiotics, okay?
We've had cobras, we've had mambas, we've had all kinds of things. I hate people, I like animals, so they're a lot nicer.
Apollo should feel like a champ in no time. Meanwhile, Rupert.